So we're right in the heart of the community in Bognor Regis. So we have people from the surrounding areas come to us, and we run about 25 classes a week. So within those classes, we've got some people with very good abilities, but people with less ability as well. So full range of people with different conditions that we can support on a daily basis.
I came here and I had just moved to Bognor, no nobody. Unfortunately, about 4 years ago, I had breast cancer, and it affected the two of the vertebrae in my spine. I cannot stand for any length of time. So I decided I had to do something. And I looked in the door and I thought, it's a load of old women sitting on a chair. I, of course, at 72, I'm young, you know. And somebody said, well, try it. At the end of the class, I was so knackered. I realized 2 times a week would help me more than 1 time a week. That was my original thought. But when I went to this class and met the instructor, I realized that's just what I was looking for. There's a woman who comes to the Tuesday class, and I started that class sorry for myself. She's 92. She is absolutely marvelous, and I think if she can do it with the support, I can do it too.
I have COPD, and I have spondylolisthesis, which is a back condition which affects my mobility. The slightest things like hoovering, it really has an impact on with my breathing. They say use it or lose it. You've got to keep moving. If you find you can do it within the class, you push yourself more outside the class. It's a safe area where you can push yourself to the limit and know that there are people around you that can help you if you do have a problem. And it's meeting with people that have very similar conditions as well. It shouldn't be a short-term thing. It shouldn't be a 12-week course and that's it. Because people like me are left in the lurch. It's got to continue.
The impact this class has had on the participants has been quite amazing, actually. It's been profound. The biggest challenges that I have sometimes with clients to get them to understand that they can move, that they can exercise. So a lot of times they come in, have a chat with me first before a class, before a session. And then once they see the motivation coming in within themselves, everything starts to happen. There's quite a few clients have actually said to me as well, I couldn't do this and I couldn't do that. I couldn't even reach for my tea jar, you know, and now I am. And I just love hearing that. That gives me great joy, and that's why I do what I do.
We've got some funding to put together the classes. So what it does, it allows us to engage with more people who may not think that physical exercise is for them. If we can work more in the future, it's only going to encourage more people to be active and live a healthier lifestyle.
I now have a circle of friends. They're all quite mad, really, but then so am I, so it works well. And of course it's helped my physical health, but the main thing for me is I'm part of something.